Today we talk about when can you finally stop holding your breath and start enjoying your pregnancy.
I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday.
The moment you see a positive pregnancy test, the excitement kicks in, but so does the worry. Every cramp, every symptom, or lack of symptoms can send you down a rabbit hole of anxiety. But for those who struggle with infertility, that fear is amplified. Unlike someone who conceives naturally or might be comfortable waiting until 12 weeks to see an OB, us fertility patients have been through too much to wait. We track every milestone. We analyze every detail. We wonder if this pregnancy will finally be the one. But the truth is, miscarriage risks change week by week. And at certain milestones, those risks drop significantly. So when can you finally let your guard down? Well, let's break it down today, step by step. The early weeks. The early weeks of pregnancy, which is between weeks 3 and 4, are the highest risk. The odds of a miscarriage at this time is about 1 in 4 pregnancies will end in a miscarriage. That's 25%. Now, most of these are due to chromosomal abnormalities and often go unnoticed, such as a late period or maybe a little bit of a heavier period. These are usually marked by a heavy period with cramping, and that may indicate a loss. The takeaway is, it's too early to let your guard down at this point. But early losses are usually not preventable either, because they're usually due to chromosomal problems. The first signs of hope. When you see that gestational sac between weeks 5 and 6, your miscarriage rate now drops down to 20% or less. It's only 1 in 5 pregnancies end in a miscarriage. If you listen to last week's episode, we talked about blighted ovums. And so at this point, you want to make sure you see a gestational sac with a yolk sac within it. Seeing a gestational sac on ultrasound is a good sign. And if you're one of the lucky ones to see an early heartbeat where there's a flicker, the chances are even better that the miscarriage rate will go down. As with the early portion of pregnancy, light spotting is very common, but heavy bleeding could be a concern. If that occurs, please make sure you reach out to your doctor. Overall, at this stage, there's some reassurance, but it's still a delicate phase. The heartbeat milestone. At this point, you're about 6 to 7 weeks, and the odds of a miscarriage are about 1 in 20. That means 5% or less are going to have a miscarriage once the heartbeat is detected. This is truly one of the first major turning points. The majority of pregnancies will continue successfully from this point. Now, while the fear is normal, the data does show that making it here is a great sign, and the chances are things will go well. Now, it doesn't mean everyone will end up having success, but overall, statistically, only 1 out of 20 people will end up having a miscarriage once hitting a heartbeat at 6 to 7 weeks. One interesting fact is that if you see a heartbeat by 8 weeks, at that point, most of the organogenesis has occurred, and now your miscarriage risk is equal to those who went through PGTA, which is essentially less than 5%. When you have PGTA, your chances are always less than 5% of having a miscarriage. So for those who did not have PGT testing, once you hit that 8-week mark and see a heartbeat, you are at the same risk of a miscarriage as everyone else who did PGTA. The end of the first trimester. This phase is somewhere between 8 weeks and 13 weeks. The actual end of the first trimester is at 12 weeks. The chances of miscarriage now are less than 1 in 25, which means less than 4% chance of a miscarriage. At this point, the placenta has started taking over, which further reduced the risk of a miscarriage. Even subchorionic hemorrhages now, which are usually small, are tiny compared to the size of the placenta, which reduce the risk of a miscarriage at this point. This is a common point where a lot of people will announce that they're pregnant, because again, less than 4% are going to have a miscarriage. Now, if you're a fertility patient, you probably are still scared, and for good reason. You've worked so hard to get to this point, and so it's not unusual for fertility patients to hold back from sharing the news at this point, and usually like to wait until the anatomy scan at 20 weeks. However, if you made this far, the odds are very much in your favor, and it's not unreasonable to let people know the happiness that you have just obtained through your successful fertility treatment. The second trimester. The second trimester is between weeks 14 and 20, and this is essentially the safe zone. The odds of a miscarriage are less than 1 in 100, meaning less than 1%. If you made it to this point, take a deep breath and relax. Now, in no way am I saying that something can't happen. I'm just saying the chances are so low at this point. This is why we usually call this the safe zone. But as a fertility patient, until that baby is in your arm, it may never feel safe. But from a medical speaking standpoint, you can truly let your guard down now. This phase is also sometimes called the honeymoon phase of pregnancy because this is when all of your energy starts to return and nausea usually reduces. The other best part is you usually undergo your anatomy scan where you're able to be told everything is looking really good. 24 weeks and beyond. For people who have got pregnant naturally, 20 weeks is in their mind the safe zone. And that is because most of them end up going on to have success, like we talked about, less than 1%. But for fertility patients, 24 weeks is really the one that we look at. The reason we like to look at that is almost the first time that the baby can survive outside of the womb. Yes, you will read about fetal viability sometimes at 23 weeks, but most of that data is usually based off of the fact that the baby may have incorrect dates and really was closer to 24 weeks. And so if you're looking at a measurement and say, well, where will the baby have viability? In general, think 24 weeks. Now, I don't want to confuse this in any way. It doesn't mean at 24 weeks that the baby will survive. It just means it's hit the point of viability where there's a chance. And you're looking at around a 50 to 60% chance of survival with intensive medical care if the baby can make it to 24 weeks. So where our discussion is going to go now is after 24 weeks, it's not about miscarriages anymore, but more about the risk during pregnancy, such as preterm labor or preeclampsia that can lead to the baby being born early, and what are the risks of that. So as I mentioned, at 24 weeks, the neonatal mortality rate is going to be higher. And this is because every baby is slightly different when it comes to their lung maturity and how well they're going to do. To give you an idea of the difference between advanced age and early preterm age, at 22 weeks, about 76.5% of fetuses will pass away, whereas at 36 weeks, 0.2% will. I remember with my wife, many times I would say, I just hope we can make it to 24 weeks, because in my mind, it was the first point that my child could survive outside the womb. But the real number, I would say, was 28. And I knew that because at that point, almost 95% of babies born by 28 weeks are going to be fine. Now, when I say fine, I'm saying may not have mortality. They may still have some morbidity that leads to complications. Just like mortality, as the fetus gets further along, there is less chance of morbidity, such as things like cerebral palsy, respiratory distress syndrome, and infections. But the reason why my wife and I wanted to get to at least 28 weeks is if you have twins and they're identical, that is the point where if there is twin-twin transfusion, the babies can usually survive even if it develops that late. Whereas if it's earlier, it can cause some great concern. By 30 weeks, the mortality rate is less than 1%, and by 31 weeks, it's 0.3%. As you get further along, it even goes down. By 36 weeks, 0.2%, and by 37 weeks, there's only about 1.1 mortalities per 1,000 live births. At this point, it's no longer about the baby not surviving, but usually a complication that can occur. I wish I could tell you this is the rule, and that there is never the exception to these rules, but that is not true. Matter of fact, I've had patients who have made it all the way to term and unfortunately had a cord accident where the baby cut off its own blood supply from twisting around too much. I've had babies who have been born, who then following afterwards, something happened. There are many people who make it to 20 weeks and then can lose their baby at 22 weeks. This podcast is not being done to tell you it's safe. It's just trying to give you a statistical idea of if you can breathe a little bit better. There is never a point you're going to feel comfortable when you have to go through fertility. My daughters are now 18 years old, and I get scared every time they want to go to a party by themselves. I'm not going to pretend when they were born that I wasn't a helicopter parent watching to make sure everything's okay, because I worked so hard to get them that my fear of losing them is probably unhealthy. It's unfortunate that miscarriages happen. It's unfortunate that some babies are born premature. It's unfortunate that sometimes there are fetal deaths. I hope this never happens to you, but I also hope that you now can at least take a deep breath and sigh to know that you may be past a point of great concern, and that, statistically speaking, chances are everything should go fine. Maybe some of you already knew these statistics. Maybe you weren't worried, but maybe you have a friend who doesn't know these statistics. Maybe they think that their miscarriage risk is 25% at 8 weeks. And what's interesting is that even if you have had recurrent miscarriages, technically, the rate's not as high as many people think. And so if you have a friend who thinks this, or has a friend who might be newly pregnant and is worried about these things, let her know about this episode. It might be able to relieve some of her fears. More important than my podcast is to talk to your doctor. Sometimes your situation might be slightly different, and so it's always good to talk to your doctor who can really give you your specific risk. As always, I greatly appreciate everyone who listens to this podcast, and I really appreciate everyone telling everyone about it. If you like us, give us a 5-star review on your favorite medium, and tell all your friends about us. I look forward to talking again next week on Taco Bout Fertility Tuesday.